Okay, so you have the Kaler hospitals, is the 3 hospitals that work within them, and then you graduated in 1944. And tell me again, why did you have a Mayo Clinic nursing cap? How's the Mayo Clinic connected to Kaler?
Because all of our patients and doctors came from the Mayo Clinic. We were connected with the Mayo Clinic, but so was St. Mary's, and we had no connection with St. Mary's. That's why I affiliated at the University of Minnesota for 6 months, 3 months of OB training and 3 months of pediatric training, because Rochester was not a very large city at that time, and all of the obstetrics and pediatrics went to St. Mary's. So the Kaler hospitals didn't have that specialty for our training. So we had a choice of going to Chicago or Minneapolis. And I chose to go to Minneapolis. But while we were in the obstetrics was a small hospital for unwed mothers. And these mothers, in those days it was very dishonorable to become pregnant and you weren't married. So they would tell their families they had gone to Minneapolis to work. I suppose the same thing, but in Chicago Lying In, that was called. And then after our 3 months of obstetric work, we moved to the University of Minnesota in one of their dormitories and spent 3 months there in pediatrics. And that was the time of Mother Kinney, is that her name? That was famous with the polio. She was there.
So did all of this take place in 1941 or between 1941 and 1944?
That was, well, yeah.
During those 3 years, from 41 to 44. So then you graduated in a 3-year period?
Yes.
And
in a 3-year in about 4 days, because I was sick with the flu and I was off 4 days with my classes. I had to make them up at the end of the year. End of my...
So you had to go a few extra days
over
the other girls.
But that was small, considering what some of them had to go before they could.
Right.
I don't know, we probably had our RN before we ever, some of the girls ever graduated.
So when you graduated from Kaler hospitals, you graduated as an RN, registered nurse?
I had taken my boards.
You took the boards and passed. And was that when you got a cap, a nursing cap, at the graduation ceremonies?
No. It was after our probing period.
So you were on probation as a RN?
I was on probation to stay in the nursing school. We wore white uniforms. And the only RNs on the floor were the head nurse and the assistant head nurse. All the scout work was done by the students. And now this is to Rochester, the Mayo Clinic patients. It was wealthy patients came. But at that time, the thing I heard was that the Mayo Clinic charged on your ability to pay. However, a lot of famous patients were there. And so they had us in white uniforms because most student uniforms were blue and white striped. But we wore white. And after our probing period, after 6 months in training, we wore a hat. It was not the Mayo Clinic hat, it was the Kaler Schools of Nursing. And then when I graduated, we got our little square gold pin. But the pocket on our uniform had S-K-N. It always looked like skin. Mm-hmm. But it was Student Kaler Nursing. But if you just glanced at it, it looked like skin.
But that probie period took place after you were actually an RN.
No.
Oh, you didn't become an RN until after that probie period.
Didn't become an RN after I graduated from nursing school.
So when was the probie period?
The first 6 months. We had 3 years. Mm-hmm. I went in February of 41, graduated in February of 44.
So the first 6 months of those 3 years was your probie period?
Yeah, we didn't wear anything on our head.
Okay.
But then we wore the hat, and we better have it on too.
So you did wear that Mayo Clinic hat for a good 2.5 years that you were in nursing school. I see.
It was a Kaler hat.
Oh, okay. And then when did you get the Mayo Clinic hat?
Never got a Mayo Clinic one.
Oh.
I got a page. They sent a page with the, no, they didn't either. They sent Dr. Mayo in the Army had signed his name on a piece of paper. I don't remember how many there were in our graduating class because they took students in February and in September. And the ones that came in September of 41, they were also the class of 44. Mm. February, they took in fewer than September. And then see, if it was a Mayo Clinic hat, then St. Mary's would have been wearing it too. So it definitely was Kaler hat, because St. Mary's hat was different.
Uh-huh. Okay.
But it was very distinctive after I started work here at the University of California and in Hillcrest. One of the doctors from that wasn't in the medical school came up to me and asked me if I graduated from Kaler in Rochester, and I said yes.
And you knew that because of your
my hat, because we started wearing hats until a bunch of good nurses never had them on. They kind of quit wearing hats when ICUs came into being, because they were on their head and they were always getting them caught in the machinery in an ICU. So they allowed the ICU nurses to not wear their hats. If they wanted to, it was optional.
What year would you guess that was around? That the hats were
optional. Let's see, it was after I started work. In what's 17 from 85? And 68, I guess.
Yeah.
So it was in the
late 60s.
Yeah, because the University of California had their eye on me to be the head nurse in the CCU, And so I was in classes a lot of time learning to read the monitors, you know, and the EKGs and all the stuff I needed to know to be in an ICU. And then they needed a head nurse on 11th floor to open it up. The 11th floor had been a TB ward, communicable diseases ward. And they wanted to make it all private rooms. And then they wanted to make it VIP, private, you know. Mm-hmm. So they wanted me to go to be the head nurse to make this change. So I got a call from the director's office to come down and see her. I didn't know what I'd done, why I was going to see the director. On the way down, I met Vivian Trailer, who was the head nurse on 6th East, mm-hmm. which is TB ward. And she was going to go see me, the head of the director of nurses too. She didn't know why she was going. So we got there. And what the director of nurses wanted to do was change the 6th East to the 11th floor. And all of our patients and nurses from the 11th floor to 6th East. Well, it ended up somehow or other there weren't any nurses left to change. And there was only one patient left. And I was up on 11 West to open that ward for private patients. And that was the job.
So was that a promotion for both of you?
No.
Just a change in floors?
Yeah, because Vivian was already, it always seemed backwards to me. The assistant head nurse was head nurse 1, and the head nurse was head nurse 2.
Mm-hmm. So 2 was a higher rank than 1.
And Vivian was already a head nurse 2. Uh-huh. But I had just become head nurse 1. Uh-huh. So the funny thing that happened that day, we were up there, and 10 West having been communicable, there were a lot of drug addicts and you know, those type of patients. And they were stealing at the hospital blind. You know, our ceiling was these big squares that you could push up and get up in, because we were the top floor. Uh-huh. We pulled stethoscopes, blood pressure, cuffs, and everything out of that attic part.
Because the drug addicts were hiding them up there?
Yeah.
Oh my goodness.
And so I had a big trash can that I pulled into the nurse's station. Uh-huh. The one patient we had was right across from the nurse's station. And he was too critical to be moved. So I needed one nurse to take care of him and the other nurses to help me get this ward ready to admit the patients. And we had this big trash can. And Mrs. Reed was the supervisor. And she came through there, and Mrs. Reed was a black, was part French. And she was looking at the trash can and things we were throwing away. And she pulled out just the the blood pressure cuffs that came in a container. Wasn't really a box. She pulled this out and she said, "What? You're throwing away the university property for. You're not supposed to discard that." I don't know who threw it in there. Anyway, I remember she pulled that out. It was so good for anything. Didn't have the blood pressure cuff. But that was Gwen Reed. Yeah, I loved her.
So, what was your last title that you had before you retired?
That's another. While I was working there, we had about 4 different assistant nurses. And each one built up her empire under assistant director. Each one was adding more. And finally got to where one that the only thing left to promote me to was, and four other nurses, I think that were head nurses by that time. The 5 of us was to assistant director of nurses. It was just a title with a pay thing. That's how they gave us pay raises, was to change our title. And the last one to do it, I was assistant director for over a year because they finally chose, I can remember her first name, Sonia, but I always want to say Henny. She was a skater star, Sonia Henny, and I've forgotten the nurse's last name, Sonia. Her first name. She was hired just as the not depression, but the high-paying salary of everybody to come in and clean it out. You know, too many nurses and too high a salary and everything. So she had to lay us off. And that hit me as kind of a shock. Ralph was wanting me to retire because he retired 2 years before I did. But I didn't want to. I was drawing a good salary and I was the same thing as a supervisor. I had all the medical floors. I had 9th, 10th, 11th, and 6 East, 3 in it. Okay, that's 7 wards. Supervisor.
Wow.
So I went back to doing the work of a supervisor, but I had a nice title and a nice pay raise. And she finally got, what she did then was she had to lay off these 5 assistant directors to get that salary back into the job. And when she told me, it shocked me, and I said, "Well, you don't need to lay me off, I'll retire." And then in retirement, I had something like 3 months of sick leave on the books. And a lot of vacation time. So they had to pay me for my vacation time, but not my sick time. But my sick time did account for the date of retirement.
It applied to your retirement, giving you additional months of employment.
Yeah.
That's great.
So they did me that way. They wanted to keep me then. I had one nurse at 10 East, she was Filipino, that I didn't give too good of a valuation review. She was going to National University, to get her degree in nursing. And she'd come to work, and we each had this little office in the nurse's station. She'd go in her little office and close the door and stay there. She was studying. She wasn't being a nurse. And the nurses were complaining about her and everything. So, anyway, I don't know whether they were going to lay her off or what. But anyway, she had a grievance. There wasn't a union, but they were about to start a union. And she filed this grievance, and through the university system, there had to be a hearing in that. And when they had the hearing, they called me as a witness with it and everything. So I was instrumental in everything. And they wanted me to stay and be the union representative. We could be the representative of the administration. And by that time, my retirement was looking better and better, and I said, no, I want to retire.
So what year was that?
1985. And Dad retired in 83.
Cool.
So then, I was 65 that year. And I must have started drawing Social Security or something. Anyway, we used our Social Security checks, put them in the bank, and when they got big enough, we took a big trip on Social Security because we could live on our pension.
Right, right. And you did a lot of traveling.
Yeah.